Hi there, my name is Jared Busby. I'm going to be a respiratory therapy student for the day. So, if I could real quick, can I see your patient wristband? Okay, can you repeat your name and date of birth back to me? Thank you very much. So what the doctors ordered for you today is they want some sterile suctioning. What that entails is I'm going to go in and I'm going to suction out some of the secretions that are in your lungs. Okay? So first thing you want to do is you want to explain to the patient what you're doing, why you're doing it, assess the patient, breath sounds, respiratory rate, all of that, make sure the patient's okay. Next thing you want to make sure you do before you get in the room is you're going to gather all your materials. I did not need a sputum trap because we're not collecting sputum for a sample. So you're going to have your suction device, you're going to have your sterile gloves, and if you need it, Yankar. And make sure you also have a bag valve mask. Okay? Next thing you're going to do is I'm going to go ahead and set up the patient suction pressure. So it's off right now. You're going to turn it on. Occlude the airway with your thumb. And if you look right now, it's at 150. The typical range that you want for an adult is 120 to 150 millimeters of mercury. So that is the pressure that we're using for this patient because he is indeed an adult. Before you start suction, another thing you want to do is you want to make sure you identify what kind of airway that is in place for suctioning. In this case, our patient has a nasopharyngeal airway. It's a 34 French. Listen to breath sounds. And position your patient accordingly. I've propped my patient up on a pillow, so I have a better angle for suctioning. So, before you do anything, what you're going to do is oxygenate your patient. So, 30, 60 seconds, 100%. Before you touch your suction device, you're going to want to go ahead and get your sterile gloves on. So, with the first cuff, what you're going to do is you're going to grab this part of the cuff right here, the folded over portion, because this is the non-sterile portion of the glove. You're going to slowly slide your hand up, like so. So that's sterile. For the next glove, you can do a combination. So what you're supposed to do is you're supposed to get your fingers on the underside of the glove like this. Identify which way your thumb is going. And slowly slide it in. Next thing you want to do is you're going to designate a sterile hand and a non-sterile hand. So this is going to be my non-sterile hand. Non-sterile hand is going to hold this part of the suction device. Go ahead and pull this down, pull this with this part of the hand, plug this in. Okay, so I've already oxygenated my patient. You get about 15 seconds to do this, so you're going to slowly feed until you feel resistance. Then you're going to pull back 2 centimeters above the carotid. Now, intermittently suck, and you're going to swirl it as you're going out. And then, listen to breath sounds still of bronchi. You're going to then pre-oxygenate the patient again. Then you can go back in. All right, pull back when you feel resistance. And then suction. That's how you suction out your patient. Of course, before you are done, what you're going to want to do is you're going to then assess the patient again, make sure the patient's not in any obvious distress, discomfort. Make sure that the patient vitals look good. They're not cyanotic. Another thing that's worth noting with the bag valve mask, in this case, the liter flow that is optimal for it is 15 liters a minute. And, all right, after you're done, these are not sterile anymore, so You're going to go ahead and throw away all your equipment, other than the background mask, unless it is indicated that you're going to throw it away. So I'm just going to put all this in here. Make sure everything's in one place. That wasn't so bad, was it? Okay. Bid the patient farewell. Document.
So I feel too, you wanna get this, so this
Leave.
is pointing straight up, because that's the collection that we have sampling to.